Dear scholars, welcome to Medicus Maximus. Today we march into the battlefield and conquer the mysteries of fetal circulation. So get your horses, hold your swords, and let's prepare to dominate. So what exactly is fetal circulation? Fetal circulation is a unique system of blood flow in a developing fetus that relies on the placenta for oxygen and nutrients rather than the lungs. Now, how? The umbilical veins from the placenta they carry blood to the fetus, and like pulmonary veins in adult circulation, the umbilical vein carry oxygenated blood and has three branches to supply to the left and right lobes of the liver and the ductus venosus. Now, most of this blood that passes from the umbilical vein is sent through the ductus venosus. It's one of the shunts, and remember in circulation, a shunt means a passage that allows blood to bypass its normal route. In fetal circulation, shunts are temporary connections that direct blood away from organs that are not yet functional, meaning the lungs and part of the liver. And they are nature's short course, ensuring that blood goes where it's most needed in the fetus. Examples include the brain, the heart, the placenta, and rather than wasting efforts on non-functional organs. So ductus venosus allows oxygenated blood bypass the liver into the inferior vena cava and into the right atrium of the heart. We must also understand that some blood perfuses into the liver to give it the oxygen and the nutrient it needs, and the waste products that are formed in the fetal are transferred back across the placenta to the mother's blood. So inside of the fetal heart. So as you can see in this diagram here, the foramen ovale and the ductus arteriosus and other shunts of the fetals are being showed in this place. So now when blood enters the right atrium, most of it flows through the foramen ovale into the left atrium. Remember, in normal circulation, blood is supposed to flow from the right atrium to the right ventricle and then via pulmonary arteries to the lungs and then that veins to the left atrium and so. But in fetal circulation, blood enters into the right atrium and flows through the foramen ovale to the right atrium. Then it passes into the left ventricle and then to the ascending aorta. So the foramen ovale is another shunt in fetal circulation. Remember, there are three shunts in fetal circulation: the ductus arteriosus, foramen ovale, and ductus venosus. All right, from the aorta, blood is being sent to the heart muscle itself and the brain and arms. And after circulating there, blood returns to the right atrium of the heart through the superior vena cava. Very little of this oxygenated blood mixes with deoxygenated blood. Instead of going back through the foramen ovale, it goes through the right ventricle. Like from the superior vena cava, the oxygenated blood flows directly from the right atrium into the right ventricle. It doesn't pass through the foramen ovale this time, it flows directly to the right ventricle. Thus, less oxygenated blood is pumped from the right ventricle into the left atrium. Now, most of this blood is shunted again through another shunt known as the ductus arteriosus because the lungs are filled with fluid and are not expanded with air. Remember, in the lungs in adult circulation, the lungs are they contain alveoli which expand, which are filled with air. Then via this descending aorta, this blood then enters the umbilical arteries and flows into the placenta. Now, in the placenta, carbon dioxide and waste products are released into the mother's circulatory system. Oxygen and nutrients from the mother's blood are released into the fetus blood. Now that's it for fetal circulation. Now there's some changes that occur functionally after birth. Now at birth, the umbilical cord is clamped and the body no longer gets oxygen and nutrients from the mother. With the first breath of life, the lungs start to expand. The alveoli in the lungs are cleared of fluid, and then the body experiences an increase in blood pressure and a major reduction in pulmonary pressure, which reduces the need for the ductus arteriosus to shunt blood. Now, all these changes they help to close all the shunts. They raise the pressure in the left atrium of the heart and lower the pressure in the right atrium. Now, this shift in pressure also stimulates the foramen ovale to close. So now, some of the changes that occurs during after birth include number one, closure of the foramen ovale. Now, the foramen ovale closes physiologically within minutes to hours due to the increased left atrial pressure from pulmonary venous return and increased right atrial pressure because the umbilical flow is gone. So the septum primum and the septum secundum they press against each other and they seal it functionally. Then anatomically, the foramen ovale closes by 3 to 12 months, leaving the fossa ovalis in the intraatrial septum. Yeah, this is the fossa ovalis in the intraatrial septum of the heart. So this is what is formed from the closure of the foramen ovale. Then number two, closure of the ductus arteriosus. The ductus arteriosus closes physiologically within 10 to 15 hours, and in some infants it could take up to 2 to 3 days, and it's triggered by an increase in oxygen tension and decreased prostaglandins. Anatomically, the fibrous tissue proliferation occurs within 1 to 3 minutes, and this becomes the ligamentum arteriosus. As you can see here, this is an image of the ligamentum arteriosus, which is formed by the closure of the ductus arteriosus. And the ductus venosus closes within hours after birth, as blood flow from the umbilical vein ceases, and it becomes the ligamentum venosus of the liver, which is shown in this diagram here. Then other umbilical vessels, such as the umbilical arteries. Remember, there are two umbilical arteries and one umbilical vein. So the umbilical arteries constrict rapidly as smooth muscle responds to oxygen, closes functionally within minutes and anatomically within 2 to 3 months, becoming the medial umbilical ligament. The umbilical vein remains patterned longer enough to allow blood to return from the placenta for a short while, closes physiologically within hours, anatomically within 1 to 3 weeks, and becomes the ligamentum teres hepatis. There are some defects that occurs when these shunts fail to close, such as patent ductus arteriosus, which arises from the failure of the ductus arteriosus to close, which causes blood flow from high pressure aorta to pulmonary artery, causing left to right shunt. And then secondly, you have patent foramen ovale, known as atrial septal defect, which arises from failure of the foramen ovale to fuse properly, causes left to right atrial shunt, and results in paradoxical embolism. Now, there are differences between the fetal and adult circulation. So in features, we have the feature, we have the fetal circulation, and we have adult circulation. So now we're going to look at the fetal circulation source of oxygen. Now, for fetal circulation, your source of oxygen is primarily from the placenta via the umbilical veins. Then in the adult circulation, it's from the lungs via the pulmonary alveoli. Then the oxygen level in the blood in fetal circulation is mixed, and it's due and it's highest in umbilical veins and it's lowest in the superior vena cava. Then in the adult circulation, it's uniformly high, and we have the systemic arteries, which contain about 95 to 100% of oxygen. Gas exchange sites. The gas exchange site for fetal circulation is primarily in the placenta, especially in the maternal blood, and from the lungs, alveolar capillary interface. We have pulmonary vascular resistance that is high in fetal circulation and low in adult circulation, and the systemic vascular resistance, which is low in fetal circulation and high in adult circulation. The main function of the right ventricle is to pump blood into the systemic circulation via the ductus arteriosus, and the main function of the right ventricle in adults is to pump blood into the pulmonary circulation. Quick summary of everything we've done so far. So, blood flows from the placenta to the umbilical vein, to the ductus venosus, even though a small amount perfuses to the liver, and then back into the inferior vena cava, to the right atrium, to the foramen ovale, to the left atrium, to the left ventricle, to the extending aorta, and back into systemic circulation, and the umbilical arteries back to the placenta. And some blood enters in through from the superior vena cava, enters into the right ventricle, to the pulmonary trunk, follows the ductus arteriosus, the aorta, systemic circulation, and umbilical veins back into the placenta. So thank you so much for tuning in. Make sure you like and subscribe.